Hi, I'm Dr. Jerry Grant. I'm professor and chair of neurosurgery at Duke, and I have been treating pediatric and adult hydrocephalus for many years, almost 30 years now. Hydrocephalus is a condition really that blocks up the spinal fluid, the water in the brain. It's water on brain for a reason, because there's too much of it, either mostly due to lack of absorption or producing too much. But there's communicating hydrocephalus and non-communicating. Some of the terms now we like are obstructive versus non-obstructive, but in general, those are the conditions that we talk about for hydrocephalus. One thing that's important to keep in mind for hydrocephalus is that a shunt is life-saving. There's things in neurosurgery we do every day, but nothing is as powerful for a patient as a shunt. In terms of the innovations of what we think about over the years, a shunt is all the way at the top. But I think we're still stuck with that. We have valves that aren't perfect, and we need to keep working on innovations of how to solve this condition. We are much more used to placing programmable valves than we used to. Some of us really like them up front because we can program them and really titrate, make sure we're not over shunting and then we're not under shunting. And it's hard to get that right with a fixed valve, say in a very young child. And you hate to take someone back to surgery for a change of valve. So we really like that feature, but it's not for everyone. There are limitations of who we may not want to place a programmable valve. There's a lot of bias on how people treat hydrocephalus around the world, no question about it. And I've seen that in the United States, my partners, other institutions I've been at, outside the country. I spent a year in England, going to Uganda. So many differences of how we manage it. Some of it is cultural, because it's how they manage these conditions in their environment can be very difficult. But that's with all fixed pressure valves. But we got to choose the right one up front, because otherwise we may have to take them back to change the valve. Programmable valves, it's also an issue with programming, and if someone lives, say, very remote and they can't always come back for imaging, it may not be the ideal kid to put a programmable valve in. One of the most common indications where I place a programmable valve is the young kids with a big head, because we're very worried with those large ventricles that if we put in something fixed and they overdrain, we have a lot on our hands, because now we have often subdurals, and we have big spaces and the brain just collapses in. And it's not a good sight, because then it's very hard to get that brain to re-expand. And if they overdrain, how do we manage that? We're kind of stuck with a fixed valve. We have to take them back, put a programmable valve, drain the subdurals. You get into this cycle, and we probably could have avoided that up front. So those large heads with large ventricles, and they're not used to it, we got to be very, very careful. And those are in the very fragile kids. That might be the very young kid or the elderly. There's no different where they have atrophy, unfortunately, in the brain as you get older, and that brain will not tolerate those sudden changes in ventricular size. So we've got to be very, very gentle. So if you place those valves, we program them at a pretty high level initially. High meaning draining less, where you have to exceed a higher pressure to drain. So a pretty high setting on that valve, because we're so worried about overdraining too quickly. And then we would back off and drop that setting with time and make sure they're not developing any of these subdurals or signs of overdrainage. But those are the common scenarios where I clearly would place a programmable: the very young, large ventricles, or the elderly. In the middle, it's a toss-up, really depending on what they do. Adults are very sensitive to pressure, we find. Kids, we think, adapt better. Their brains are growing. Adults, extremely sensitive. They know what setting they're on. You drop them, they know. Sometimes they need something in between. It can be really difficult in an adult